Welcome back. Voter-approved Medicaid expansion in Missouri is in the midst of its first year of enrollment.
In the latest A Brighter Tomorrow, KIESSLING-CAVER's Nate Brenner explains how one model of care is defining a new era of public behavioral health care.
U.S. Senator Roy Blunt helped transform mental health care in 2014.
And that's one of our principal goals, frankly, to just get to where you think of behavioral health like all other health.
His Bipartisan Excellence in Mental Health and Addiction Treatment Act introduced the Certified Community Behavioral Health Clinic model.
That model has been needed for a long time to treat folks with addiction disorders and severe mental illness.
Missourians covered by MoHealthNet have access to more than 200 clinics that follow that model, such as Burrell and Compass Health facilities. Their payment models allow for sustainable care.
It has been the single biggest budgetary add to the mental health system in probably 4 decades.
Helping Missouri hire and retain health professionals.
Typically, Medicaid pays less per unit of service than private insurance companies do.
But with the CCBHC model, providers have a plethora of services available, including 24/7 crisis centers that divert people from emergency rooms. Adam Andreassen says Burrell's initial Springfield Crisis Center saves the Greene County area $4 to $6 million annually, inspiring plans for a temporary center in Columbia to operate in July.
If 20 to 30% of those that come in the door are successfully diverted to a crisis center, you're going to see massive savings, and we would expect that Boone will see a similar result.
With a new 988 crisis hotline also ready to go live in July, Andreassen compared modern behavioral health care to a style of roadway that Mid-Missourians know well.
All of those things are just different aspects of a roundabout that allows us to get people quickly identified as in need and get them into the right level of care.
And that coverage is only going to grow in Missouri.
We're asking to provide an additional $140 million to support and increase services at health centers across this state.
A Brighter Tomorrow, Nate Brenner, KOMU 8 News.